How do transplant teams make CF lung transplants possible? Imagine a team of dedicated healthcare professionals working together like a finely tuned orchestra, all focused on giving someone with cystic fibrosis a new chance at life. Lung transplants are complex procedures that requiring careful planning and coordination. When a person with cystic fibrosis develops advanced lung disease and standard treatments no longer help, a transplant might be the best option. The process begins with the patient's cystic fibrosis care team closely monitoring their lung function and overall health. When they see signs that the lungs are failing, they refer the patient to a specialized transplant center for a detailed evaluation. At the transplant center, a team of experts including lung specialists, surgeons, nurses, social workers, and other specialists work together to assess if the patient is a good candidate. They look at how severe the lung damage is, the patient's overall health, and their ability to follow complex medication routines. For people with cystic fibrosis, additional factors like nutritional status, infection history, and other related health issues are also considered. This thorough assessment helps determine if a transplant is the right step. Once approved, the patient is placed on a national waiting list managed by the United Network for Organ Sharing. The list uses a score called the Lung Allocation Score, which considers how urgent the need is and how likely the transplant will help. While waiting, the team keeps a close eye on the patient's condition, encouraging participation in pulmonary rehabilitation and maintaining overall health to improve transplant success chances. When a suitable donor lung becomes available, the transplant team acts quickly. They confirm that the donor's lungs match the patient's blood type and size, and that the lungs are healthy. Final tests are done to ensure the patient is ready for surgery. If everything checks out, the patient is brought into surgery. During the procedure, the diseased lungs are carefully removed and replaced with healthy donor lungs. For cystic fibrosis patients, double lung transplants are often performed because both lungs are usually affected. The surgeons connect the new lungs to the patient's airways and blood vessels, sometimes using a hot lung machine to support the patient during the operation. After surgery, the patient enters a critical recovery phase. The transplant team monitors for complications like infections or rejection, which can happen if the body sees the new lungs as foreign. To prevent rejection, patients are prescribed immunosuppressant medications that must be taken lifelong. The hospital stay can last several weeks, and afterward, ongoing outpatient care is essential. The team provides guidance on medications, diet, exercise, and infection prevention, with regular follow-up visits to check lung function and overall health. Living with a lung transplant requires a lifelong commitment. Patients need to take their medications exactly as prescribed, attend regular medical appointments, and follow a healthy lifestyle. The transplant team continues to support them, helping manage medication side effects and watch for potential complications. For those with cystic fibrosis, additional attention is given to managing other aspects of the disease, like digestion and nutrition, to promote overall well-being. Lung transplants can significantly improve quality of life and extend survival for people with advanced cystic fibrosis lung disease. However, they are not a cure and come with risks such as rejection, infection, and medication side effects. The decision to pursue a transplant is deeply personal and involves weighing these benefits and challenges carefully. The transplant team provides detailed information to help patients and their families make informed choices. If someone with cystic fibrosis is considering a transplant, it's important to start discussions early with their healthcare team. Preparing for the process involves medical readiness, emotional support, and practical planning. Having a strong support network is vital because the journey can be demanding, but with the expertise of a dedicated team, it offers hope for a longer, healthier life. In essence, transplant teams make CF lung transplants possible through careful patient evaluation, precise surgical techniques, and lifelong care, all aimed at giving patients a new lease on life. Always remember, consulting healthcare professionals is essential for personalized advice and guidance.